Okay, this is an educational video on flexor tendon strains of the finger. It's just like it sounds. It's a strain to the tendon itself and potentially the tendon sheath that lives around the tendon to provide nutrition to it. The typical mechanisms and presentation of a flexor tendon injury is a sudden stress on the hand and finger in a hanging position. A lot of times we see that grabbing mono pockets or grabbing two finger pockets. A lot of times this is accompanied by an audible pop in the palm, which goes hand in hand with a lumbrical injury. Strains are more common than tears, so it's important to differentiate that it's very unlikely that you tear the tendon away from the bone or tear the tendon in half. That's really not a rock climbing injury. However, getting small strains because of shearing stress to the flexor tendon collagen fibers themselves is much more common of an injury. Pain along the flexor tendon sheath is one of the classic hallmarks of this kind of injury. If we're grabbing onto a mono, grabbing onto pockets, we feel some sort of shift, some sort of give, maybe a pop in the palm, and we have pain that runs along the flexor tendon sheath. That could be an indication for a flexor tendon strain. Also increasing in pain with the open grip position. So in the open positions, when the fingers are at larger joint angles, most of that stress goes to the tendon and the ligament and the joint capsule of the fingers. When we close the finger down in a half and a full crimp position, that's going to be more load to the flexor pulley system. So if you have pain in an open-handed position, climbing in an open-handed position, heard a pop in the palm and felt kind of a strain along the flexor tendon sheath, that could be an indication of a flexor tendon strain. I already mentioned here, it's often accompanied by a lumbrical strain, which are the muscles that live in the palm of the hand. And then it also has a positive lumbrical shift sign. So a way that you can test for this is you can straighten all the fingers except for the injured finger, and you can flex it in an open-handed position. And does that reproduce the symptoms that you're getting, both here or somewhere along the line of the finger? Clinical exam. Isolated muscle testing. So I demonstrated quickly one of the muscle tests, but we also want to isolate the FDP tendon as well as the FDS tendon. If I'm trying to isolate the FDP tendon, I'm going to block the middle phalanx and the proximal phalanx and try and just flex at the distal interphalangeal joint on the finger. If I'm trying to isolate the FDS tendon, I would block at the PIP joint and block the proximal phalanx and flex at the PIP joint. If I'm looking to assess the lumbrical muscle, I want to isolate the injured finger. It's hard to lay on my table. Isolate the injured finger with all the other fingers straight and load here to see the lumbrical shift sign in the palm. If that reproduces pain in the palm, that reproduces pain down the line of the tendon, that's a potential likely diagnosis for that injury. Ultrasound is a good option for understanding the degree of injury with FDP or FDS tendon injuries. We can often see an increased cross-sectional area if this is something that's been there a while, but we can also document fluid in and around the tendon substance itself. On this image next to me, I have a picture of an FDP tendon attaching to the bone here, where we can see some indications that there was a potential FDP injury of this fluid out here on the top. So what we're looking at here is we're looking at a distal phalanx. Here's the bone, distal phalanx, and then here's the middle bone, here's the middle phalanx, and then the flexor tendon is coming in here. And it goes over the top of this tissue called the volar plate. So this increase, and it's hard to see from this picture, but increase in cross-sectional area there as compared to the opposite hand, athlete had pain that looked like it was over the DIP joint, but ultimately it looked as though it was an FDP tendon strain. This individual had been climbing on a lot of pockets, doing a lot of kilter boarding, and had a lot of pain directly under on the volar side of the DIP joint, and it also has a little bit of a fluid accumulation there, a little bit of a cystic change, and then the cross-sectional area of the FDP tendon was the way to diagnose that it was probably a flexor tendon strain. Tendon healing. Regarding tendon healing, if you've ever had tendonitis of the elbow, tendonitis in the rotator cuff, tears in the rotator cuff, loading is a good thing for tendons that get injured. The right kind of loading, the right timing of loading, and the progression of loading is really the most important thing, but there's a lot of different ways you could potentially load this to get better. So one of the things we want to do with your call is we want to organize a training routine that allows you to use equipment that you have, styles of loading that you understand, and build a progression so you can get back to normal climbing intensity, because it's going to be hard to continue climbing on a tendon strain with big holds, especially with jugs that you wrap around, especially with moonboard style holds that have a sharp kind of corner where you have to grab on the tight corners. Those are going to be kind of hard to start or continue to climb on while we got to let this thing heal. So it's essentially, tendons are made of long directional collagen bundles, and they like to be loaded. So they like to be loaded for a long duration to start. They like to be loaded with intensity as a way to make them stiffer. And then they ultimately need to be able to tolerate rapid loading again. So we first need to unload the tendon, and we need to give it some time off, let it calm down. And then we need to increase we need to reduce the stiffness. So we need to increase the compliance of the tendon by loading for a longer period of time. And then when we see a symptom reduction and we keep the loads low and then we reload, we need to increase the intensity to stiffen the tendon again. And then ultimately we need to get back to doing high velocity and high rate contact strength kind of exercises to make sure the tendon can tolerate normal sports participation loads. But ultimately it's covered by a tendon sheath, which is part of the thing that gets injured and why we get a lot of swelling and tenosynovitis with a flexor tendon injury. And then that also is designed to reduce friction, but when we get an inflammatory response, it'll increase the friction dependence, and it'll also is one of the reasons that we have to modify other things like bar activities, pull-ups, deadlifts, dumbbell activities. We need to be comprehensive with thinking about how we're going to manage this to make sure you can get the symptoms to go away and we can get you back to climbing as quickly as possible. In terms of the healing process, these things take a while. So there's not good evidence for finger injuries in terms of finger tendon injuries to recovery, but we know from elbow pain and the research on tendonitis, it's about a 3-month time period. And I would imagine this would be fairly similar in terms of its length of time. And so again, that's going to be 3 distinct phases. So I would suggest people, if you suspect you have a flexor tendon injury, you want to book one of the 8 or 12-week plans to ensure we have plenty of time to unload, to stiffen, and then to reload back to sports participation with high rate loads. Okay, so conservative management typically is similar to a tendinopathy. We need to manage the pain, we need to reduce the pain, we need to reintroduce load, and then we need to make sure we maintain the range of motion, and then we get back to full sports participation. Partial tears of the tendons, less than 60%, these are going to be managed conservatively. And typically when they return back to normal health, or the athlete gets back to their normal sport, they usually have a higher resistance to tearing again, because you'll get a little bit of cross-sectional area, and that's very common for other types of tendons that we know to have injuries in, the Achilles tendon, the patellar tendon. When tendons get injured, when they get better, they tend to be a little bit bigger in their cross-sectional area as a result of being protective. So now it's a little bit more protective, right? And that doesn't mean we want to get tendon injuries. It just means that that's one of the good sides of our bodies adapting and anticipating future stress. Complete tears, we want a surgical intervention. I've never seen a complete tear. They definitely happen. Those typically aren't rock climbing injuries, with the exception of getting your finger stuck and cutting your feet and the finger gets stuck and maybe you get degloved or something like that, which is a little bit gross. But that's not something that I've ever seen. That's definitely not a common kind of injury. Another kind of in the realm of tendon strain injury that does happen more than tendon strains or as much is getting a little avulsion injuries. So here's a little avulsion injury on this image here, where that's where the central slip would attach. So there's a piece of tendon that attaches right here called the central slip, which was an extension of the extensor tendons here. And if we get a lot of high velocity, high repetitive loading, you can get avulsion injuries. I actually saw one this morning of an athlete trailing their hand in a pocket and with their fingers in extension pushing her to pop on the volar side of the hand. So that kind of falls in the realm of tendon injury, but it also is in the realm of stress fracture to a bone. And so that's another diagnosis that we might need to rule out. So if you had an injury that looks like a tendon strain and you heard a pop and there's quite a bit of bruising and swelling, we probably want to suggest you get an x-ray. If you're in state, you can come into my office and I can order the x-ray and we can do a diagnostic ultrasound to rule in or out any soft tissue involvement. And then we're going to lead down the path of making sure we unload this, make sure we regress the exercises we're using, make sure we reload this, and then a couple months in, get back to normal climbing and power output for you and your season. That's probably all I need to say about flexor tendon strains in the finger.